First at noon, we could know soon if kids ages 5 to 11 will soon be able to get the COVID-19 vaccine. This after the FDA recommended the pediatric Pfizer vaccine last week. But it has to get the green light by a few more organizations before it can be administered on kids. Fox 12's Mia Villanueva joins us now with a breakdown of the process.
We spoke to a pharmacist here at Beaverton Pharmacy. He says before they can even start scheduling appointments, they need to have vaccine protocols issued by the Oregon Health Authority. They also need inventory of the pediatric Pfizer vaccine itself. Wade Irby, a pharmacist at Beaverton Pharmacy, says parents of kids 5 to 11 years old have already inquired about scheduling their kids' appointment for the pediatric Pfizer vaccine after it was authorized by the FDA last week. He says a few things need to happen before he'll be booking those appointments. The first, recommendation from the CDC.
So far, it seemed like pretty much a rubber stamp to what the FDA has done. But every time we have to wait and see what happens.
Once that happens, Irby says the Western States Scientific Safety Review Work Group will have to review and make its recommendation. Irby says the final green light for pharmacies, at least, comes from the Oregon Health Authority.
Then, more locally, specifically here in Oregon, the Oregon Health Authority has to issue protocols for pharmacies to be able to order and administer the vaccine.
Irby says they also still need to get stock of the pediatric Pfizer vaccine itself.
The Pfizer pediatric, which is the ages 5 to 11 vaccine, which is a little bit different strength than the adult. We can't just use the adult vaccine on the children.
It's a lot of steps, but Irby says that's because the pediatric Pfizer vaccine has been recommended by the FDA under emergency use authorization. Irby calls this process for this vaccine more rigorous because it is needed as soon as possible for the general health of the public. He says it's a much different process than most vaccines, which are instead approved by the FDA.
Approval is something more permanent, more long-standing. It generally doesn't have to go through quite as many steps.
Irby says the process of getting vaccines into clinics and hospitals may be different than it is at pharmacies. If you have any questions, he says to contact your provider. Reporting from Beaverton, I'm Mia Villanueva, Fox 12 Oregon.